Hello, today I'm talking about blood flow and erectile dysfunction and PCOS. So, when I treat people, I'm always looking at how blood is flowing, where is it flowing, and what is the quality of the blood. And there's a lot of ways that I can evaluate that non-invasively. Whenever there's a dysfunction in the body, I'm always looking to improve microcirculation and to improve the quality of the blood that's coming through. When blood gets into the deepest, tiniest little crevices of the vessels, those are called the capillaries, and it's at that level that nutrient exchange and oxygen exchange occur, and waste gets removed from the area and travels out through the lymphatic system. So that's the microcirculation, and if you want to improve the health of anything, improve the microcirculation of that area. I'm leading a course on October 3rd. You're all invited. It's how to address pelvic problems holistically, and we're going to be going over how to improve the microcirculation and how to improve the quality of the blood that's coming through. So one way that you can start checking in with the quality of your blood, and one aspect of your blood, is a blood glucose monitor. So you would test your blood sugar levels when you have fasted for 8 hours. Ideally, just maybe water is the only thing that has come through the system. And this reading, when it is 125 or more, you have diabetes. When it is 100 to 125, it's considered prediabetes, and ideally you're under 100. I say you're aiming for 80 to 85 upon waking. And what does that have to do with erectile dysfunction and PCOS? Men or anyone with a penis who has diabetes is 3 times more likely to experience erectile dysfunction, and women or anyone with a womb diagnosed with PCOS, more than half will develop type 2 diabetes by the time that they're 40. So what that is informing me is that the blood, the quality of the blood is compromised as a correlation with those conditions. So anytime that the body is struggling to clear sugar from the blood, I always look at the liver. You have to look at the liver. Why is the liver overwhelmed? The liver plays a big role in regulating blood sugar. So what's going on at the level of the liver, and how can you better support the liver so that it is storing sugar and producing sugar, and the pancreas is not overwhelmed? And so in those conditions, erectile dysfunction and PCOS, we're going to be going over why is the liver so overwhelmed in those conditions, and how you can start turning things around holistically. So this is what's considered an objective value. It means that it is a hard, fast number, and whenever you provide a report of what your experience is with a condition, you are reporting things subjectively. And we can all get emotional about our health, myself included. So when you ask, oh, are you making progress? Most people are like, not really, it's the same. Or maybe they say they're getting better, but objectively there's not a measurement to reflect that. So either way, having some objective measures be a part of your understanding can be really, really helpful. There was a time when I was having this really peculiar ache and pain in my body that no one could really tell me what was going on. And I just happened to become more consistent about checking this. You do not have to be a grandma to check your blood sugar. You can get one of these monitors over the counter online without a prescription for like $20 to $30. So I happened to start checking my blood sugars consistently and noticed that that strange ache and peculiar pain was present the mornings when I was waking up with my readings over 100. So it was a really good way to give me more direction about what my next steps needed to be, and it no longer made the pain so mysterious. There was something I was doing the nights before with my diet, and then there was other things I needed to do to better support my liver, and that this was just one way for me to get feedback for something that felt so mysterious. And I know that in terms of regulating blood sugar and erectile dysfunction and PCOS, oftentimes that, and along with many other conditions, the solutions or the remedies or the band-aids are pharmaceuticals, and that is a perfect route if that is what you prefer. However, when you're trying to manage things holistically and you're trying to get understanding bigger picture of what's happening and how you can start supporting yourself, I find that this is really helpful. If you want to join me for my holistic solution to pelvic problems, starting October 3rd, you can hit me up at madeitcho.com, made, M-A-D-E, itcho, H-E-C-H-O.com. Take care.